Does that say what I think it says? Let's talk about interpreting ethical obligations of mental and behavioral health professionals. Hi, I'm Katherine Crace. I'm a lawyer, social worker, researcher, and ethicist, and I'm here today to help you interpret the ethical obligations you have as mental and behavioral health professionals. So, a rule's a rule, right? But what if the answer to that question's actually maybe? Professionals often seek guidance from their respective codes of ethics when they're faced with a situation that they're not quite sure how to proceed with. It would be really easy if the codes of ethics of our professions always had a clear answer, but they don't usually. That's because professional codes of ethics are designed to provide us, as professionals, with constructive guidance that we can individually apply to our particular situation. There are so many different variables at play in an ethical conundrum that professional codes of ethics can't cover them all. So instead, they provide language to help guide us, the professionals, in our decision by highlighting factors that we need to consider. In general, there are three types of ethical standards: permissive, suggestive, and restrictive standards. Let's talk about each type of standard. Let's start with permissive standards. Permissive standards often use language like may or are allowed to. These standards make clear that there are permissible actions that can be taken by a professional, but those actions aren't required or they're not even necessarily recommended. For instance, Standard A10.3 of the Code of Ethics of the American Counseling Association says, counselors may barter only if the bartering does not result in exploitation or harm, if the client requests it, and if such arrangements are an accepted practice among the professionals in the community. This standard can be interpreted to mean that counselors are allowed or permitted to barter when the conditions meet the expectations outlined in the standard. However, the code does not require counselors to participate in bartering, nor even suggest that bartering is a good idea. Now let's talk about suggestive standards. Suggestive standards are worded a little more strongly than permissive standards. Suggestive standards often use the language should or should not to describe the expectations of a professional. These standards set up an expectation for a practice or against a practice, and the expectation of suggestive standards usually has many options or exceptions. For instance, Standard 1.07, subsection C of the Code of Ethics of the National Association of Social Workers says, social workers should protect the confidentiality of all information obtained in the course of professional service except for compelling professional reasons. This standard places an expectation on social workers to protect client confidentiality. But to distinguish from a permissive standard, the standard goes farther than to say that social workers can protect client confidentiality or that they may. The use of suggestive language here puts responsibility on the social workers to protect client confidentiality, but provides exceptions. Now let's talk about restrictive standards. Restrictive standards are strongly worded and usually relate to significant expectations of a professional. These standards sometimes use the words must or are required to. They also might be worded in the negative, like must not or do not. Restrictive standards sometimes provide exceptions, and they should be carefully heeded. For instance, Section 10.5 of the Ethical Principles of Psychologists and Code of Conduct of the American Psychological Association says, psychologists do not engage in sexual intimacies with current therapy clients or patients. This standard is clear. It is never okay for a psychologist to engage in sexual intimacies with a current therapeutic client or patient. There are no exceptions or considerations. If you have sex with a current therapy client, you are liable for an ethical violation without concerns for other factors. This is a restrictive standard. There are other standards related to sexual intimacy of psychologists and former therapy clients or patients. For instance, Section 10.8a says psychologists do not engage in sexual intimacies with former clients or patients for at least 2 years after cessation or termination of therapy. Paragraph B of that standard further clarifies the concerns to consider in such situations where a sexual relationship after 2 years post therapy is being considered. Even though this standard allows for sexual relationships in some situations with former clients, Section 10.8 is still restrictive in that it is never okay for a psychologist to engage in a sexual relationship with a former client until after it has been at least 2 years since the therapeutic relationship has ended. Professionals have a lot of autonomy to make decisions about what is appropriate professional practice and what is not. Professional codes of ethics are there to guide these decisions. When using the standards provided in our professional codes of ethics to evaluate our choices, we need to pay attention to the language of the standards to determine what level of latitude we have to make decisions for ourselves. For more information and resources, check out www.makingthetoughcall.info and www.craceconsulting.com.